everyone, welcome to my channel. Today I am going to explain about hospital pharmacy and its organization. What is a hospital pharmacy? A hospital pharmacy is defined as the unit of a hospital that undertakes the activities of procurement. Procurement is nothing but collection or purchase of drugs or medicines or surgical equipment. So a hospital pharmacy is responsible for procurement or manufacturing. So in previous days, hospital pharmacy used to manufacture all the medicines. They used to compound all the medicines. But right now we are not manufacturing medicines in the hospital pharmacy. There are separate manufacturing units and manufacturing companies for that. So in hospital pharmacy, what we will be manufacturing is IV preparations. IV admixtures and IV preparations will be manufactured in the hospital pharmacy. Then testing. So we have to test the drugs for the quality. We have to test the IV admixtures whether they are compatible or no, whether they are stable or not. It is also involved in activities like storage. So every drug requires particular storage conditions. So few drugs require storing in the refrigerator, few drugs require storing in the dry place, few drugs require storing away from the sunlight. So based on that, a hospital pharmacy stores the medicines or drugs. Compounding. As I said, in olden days, they used to compound all the medicines in the hospital pharmacy itself. So right now we are compounding IV solutions and dispensing of the medicines. So hospital pharmacy is involved in dispensing of medicines to the patients, outpatients and as well as inpatients as per the requirements of the patients in the hospital. It is under the supervision of a professionally competent and qualified pharmacist. So the head of the hospital pharmacy should be professionally competent. He or she should be well equipped with drug information, and he or she should be a qualified pharmacist. Then coming to functions of a hospital pharmacy. The hospital pharmacy functions under the guidance of a competent pharmacist, assisted by several other pharmacists. So under the head of the pharmacy there is several other pharmacists. It has a vital role in the healthcare program of the hospital. Its functions are as follows. So first function is dispensing, to prepare and supply medicines, to dispense drugs to the outpatients directly. So the outpatients will be consulting the doctor and they will be taking the drugs or medicines directly from the pharmacy. To dispense drugs to the inpatients through nursing staff. So inpatients will be provided medicines through the nursing staff. Since nursing staff are involved in the administration of drugs, they will be provided with the drugs. To dispense over the counter drugs, OTC drugs, to outside people. So OTC drugs are drugs that can be dispensed without a prescription. So dispensing of OTC drugs is also the responsibility of hospital pharmacy. Then second function is manufacturing. What do they manufacture? To manufacture and test certain drugs like IV fluids, surgical irrigation fluids. Irrigation fluids are used to cleanse the body part. Dialysis solutions, etc., which are not available from the outside sources as per the guidelines of Pharmacy and Therapeutic Committee. Then third function is storekeeping, to purchase drugs and store them under proper conditions. to control inward and outward movement of medicines from the stores. So hospital will be having drug stock or medicine stock as a separate drug store. So from there they will be moving the drugs into the hospital pharmacy. So hospital pharmacy will be controlling the inward and outward movement of medicines from the hospital stores. Then fourth function is maintenance of records. To maintain proper and up-to-date records of all the drugs purchased and dispensed. So hospital pharmacy is responsible to maintain the records of all the drugs that are purchased from the manufacturer or a distributor and drugs that are being dispensed. Then fifth function is patient counseling, to instruct the patients, also medical staff, about the dosage regimen, that is how many days the drug should be taken, the duration that the drug should be taken, and also whether the medicine should be taken in the morning or afternoon or night. This information should be provided by the hospital pharmacy. Also usage, particular drugs like inhalers, eye drops, ear drops, they require the hospital pharmacy to educate patients about their usage. So patient counseling of such drugs is done by the hospital pharmacy. Possible side effects. So the patients should also be informed about the possible side effects from a drug by using a drug. Then sixth function of a hospital pharmacy is teaching and research, to conduct and participate in the teaching programs for the hospital staff and students. So hospital pharmacy should be involved in teaching programs for the hospital staff as well as students, to assist in the various research programs of the hospital. These are the functions of a hospital pharmacy. Ordering and storage. So they will be purchasing drugs or medicines or surgical equipment from the manufacturing unit or distributing unit, and they will be storing the drugs. Then providing drug information to the doctors, nurses, patients, etc. Then dispensing to the inpatients, outpatients, and dispensing of narcotics as well as controlled drugs. Narcotics are habit forming drugs. Examples are cocaine, fentanyl, methadone, oxycodone, hydrocodone. Such drugs should be dispensed by the hospital pharmacy with a prescription. Then administration. Administrative duties are also a function of hospital pharmacy. So hospitals' other departments are under the control of hospital pharmacy. Then providing training to the nurses, interns, students and others. Then manufacturing of IV admixtures, IV solutions, ward stock orders, etc. Then let us see the organization structure of a hospital pharmacy. The following points depicts the organization structure of a hospital pharmacy. The various units of a hospital pharmacy are administrative unit, dispensing unit, manufacturing unit and storage unit. So there are 4 units in a hospital pharmacy: administrative unit, dispensing unit, manufacturing unit and storage unit. So what are the requirements of pharmacists? There are no standard rules regarding the number of pharmacists required in a hospital pharmacy. The number required is determined by the workload and bed strength of the hospital. With the increase in number of beds, the number of pharmacists required also increases. So based on the bed strength of the hospital, this is the table for required number of pharmacists. If the bed strength of the hospital is more than 500, we require 15 plus 1 pharmacists for every 100 beds. If bed strength is 500, number of pharmacists required are 10. If bed strength is 300, pharmacists required are 8. If bed strength is 200, 5 pharmacists are required. If bed strength is 100, 5 pharmacists are required. If bed strength is 50, 3 pharmacists are required in the hospital. The staff of the hospital pharmacy comes under categories like members involved in direct service to the patients. So, the hospital pharmacy staff who are directly involved in the patient service are categorized. Then members involved in technical work. So, some of the personnel will be working on technical stuff like IT stuff. So, they will be taking care of the computerized work. So, they come under technical work members. Then clerical members. Since there will be purchase of drugs from the manufacturing units and then dispensing of drugs, there will be complete inflow and outflow of medicines, and accounts should be maintained in the hospital pharmacy. So, to maintain these accounts, the financial matters will be taken care by the clerical members. Then requirements of personnel. What is the qualification required for pharmacists in the hospital pharmacy? The hospital pharmacy needs diploma holder graduates and postgraduates in pharmacy for operation. So, what is the experience required? The personnel must be experts in manufacturing, testing, clinical assessment, administration of drugs, etc. So, the staff of hospital pharmacy should have knowledge about manufacturing of IV drugs, IV solutions, IV admixtures, and also testing. So, they should be well equipped with analysis of drugs like HPLC, TLC, HPTLC techniques should be known by the hospital pharmacists, and they should be able to test the quality of the IV admixtures or drugs. Then clinical assessment. This is nothing but they should have knowledge about the side effects, drug interactions, medication errors, etc. So, they can assess whether the patient actually requires the medicine or no. If at all any side effects occurs, they should be able to know how to guide the patient and the medical staff regarding the side effects and the drug-drug interactions, etc. So, they should also have sound knowledge about administration of drugs like IV drug, IV fluids, infusions, IV bolus, IV push, then IM injections, etc. They should have good knowledge on current good manufacturing practices, CGMP, so that they can manufacture IV admixtures, and current good laboratory practices. The head of the pharmaceutical service should be a postgraduate in pharmacy with specialization in pharmaceutics or pharmacology. The head coordinates the pharmacy and non-pharmacy personnel of the hospital. He reports to the administrator and interacts with other medical staff in matters related to hospital pharmacy. Under the head, a postgraduate in hospital pharmacy is appointed as the in charge of hospital pharmacy. He or she controls the various activities of the pharmacy through proper supervision. The dispensing unit consists of pharmacists who is either B Pharm or D Pharm, diploma in pharmacy or bachelor of pharmacy. The manufacturing unit is under the supervision of a pharmacist with post graduation in industrial pharmacy. The testing of drugs is carried out by persons who have done post graduation in pharmacy with pharmaceutical analysis. Since testing of drugs requires sound knowledge on analysis techniques using HPLC, HPTLC, TLC, etc. The testing of drugs is carried out by persons who have done post-graduation in pharmacy with pharmaceutical analysis. The storage unit is under the charge of a person with B Pharm or D Pharm qualification. So this is the organization structure. Dean of the hospital, he or she is a medical superintendent. Under the dean of the hospital, there is head of pharmaceutical services. He or she should have a qualification of M.Pharm in pharmaceutics or pharmacology. Then under the head of pharmaceutical services, there is in charge of hospital pharmacy. He or she should have qualification of M.Pharm in hospital pharmacy. Then the dispensing unit, and in dispensing unit we can recruit either a B Pharm or D Pharm candidate. Then there is manufacturing unit. So in manufacturing unit, sterile products will be manufactured, non-sterile products also will be manufactured. Here they will be recruiting M.Pharm in industrial pharmacy candidates, and for non-sterile products they will be recruiting a B Pharm candidate. And testing unit, for testing unit M.Pharm in pharmaceutical analysis candidates are preferred. Storage unit, here B Pharm or D Pharm candidates are preferred. Then coming to the location and layout. Location, the ideal location of a hospital pharmacy is discussed below. The appropriate location for the hospital pharmacy is the ground floor of the hospital building, which is convenient for outpatients. Since outpatients, they just come in and they consult the doctor and they just take the medicines and leave. The location of the hospital pharmacy should be convenient for the outpatients or ambulatory patients. It must be easily accessible to the central delivery ward. So every hospital has a central delivery ward. From the hospital pharmacy, the drugs or medicine stock is taken by the delivery boy to the central delivery ward. From the central delivery ward, these drugs are distributed to each ward by the central delivery ward. So hospital pharmacy should be easily accessible to the central delivery ward, so that distribution system of the hospital is well organized. It should be adjacent to the medical store. So medical store has a stock of medicines or surgical equipment or drugs. Since drugs, whenever there is a less stock of drugs in the hospital pharmacy, we need to get the drugs from the medical store to the hospital pharmacy. So hospital pharmacy should always be adjacent to the medical store. It should be well separated from other units of the hospital, and it should be properly ventilated. Well lit and dry area should be selected. Then layout. The typical layout of modern hospital pharmacy is discussed below. The size of the hospital pharmacy depends on the size of the hospital. It should have appropriate dimensions and provision for keeping the medicaments in locker system. So some of the medications should not be available open to everyone, like controlled drugs, narcotics, drugs acting on the psychiatric system, neurological system. So these kind of drugs should be maintained in a locker system, so that they can only be accessible to the pharmacist, whoever is dispensing. Then for small hospitals, all the administrative, dispensing and manufacturing sections exist in a single room. For large hospitals, the different sections of the hospital pharmacy are separate, like administrative section, manufacturing area, aseptic area, IV admixture room. So there are separate sections for a large hospital. Then in dispensing section, there are outpatient dispensing and inpatient dispensing. And storage area is also available in large hospitals. The seating arrangement should be provided for the waiting patients. So every hospital pharmacy should have seating arrangement for the waiting patients. The manufacturing section should be set up at the back side and the dispensing section in the front portion. So that the patients won't be able to look at the manufacturing section, and they will be able to take the medicines easily from the front portion. Then floor space requirements. A minimum of 250 square feet area is required for any hospital pharmacy regardless of the hospital size. So minimum 250 square feet area is required. In the case of a 1000 bedded hospital, the hospital pharmacy should have an area of 5000 square feet and with separate outpatient and inpatient dispensing units. So if the hospital size is 100 beds, space requirement for hospital pharmacy in square feet per bed is 10. If hospital size is 200 beds, space requirement for hospital pharmacy in square feet per bed is 6. If the hospital has more than 200 beds, at least 5 square feet per bed is required. Then this is the layout of a hospital pharmacy. It has an aseptic area where sterile products are manufactured. It has no microorganisms, no pathogens. Then there is a separate manufacturing section, and there is a section for storage of raw materials. So the raw materials are collected from the raw material area and they are manufactured in the manufacturing section. Then there are stores. So finished products are kept in a separate area. After manufacturing, finished products are kept in a separate area, and stores will be having drugs, medicines as well as surgical equipment. Then in between there is a passage for the personnel to be moving from one side to the other side. Then there is an administrative section which monitors the hospital pharmacy and maintains the hospital pharmacy. Then there is a dispensing section, and in front of the dispensing section there is open space or waiting area for the patients to wait. Then coming to staff requirements, pharmacy organization in a small hospital. So in small hospital, there is an associate director. Under him or her there is a chief pharmacist. Under the chief pharmacist there is an assistant chief pharmacist. Under the assistant chief pharmacist there are secretary, OP dispensing supervisor, manufacturing and control supervisor, IV dispensing supervisor, and pharmacy residents. The secretary has a clerk. So the clerk will take care of the account section of the pharmacy. Then IP dispensing supervisor has a messenger. Since IP patients should be supplied medicines from the hospital pharmacy, they require a messenger. Then pharmacy organization in a university level hospital. So there is a director. Under the director there is an associate director. Under the associate director there are administrative services, unit dose dispensing and administration study, education and training. So administrative services can be subdivided. Under administrative services, there are research pharmacists, radiopharmaceutical pharmacists for the radiopharmaceuticals, then drug information center pharmacists. Then administrative services also has assistant director. Under the assistant director of administrative services, there are assay and quality control, sterile products and central supply. So education and training department has 2 assistant directors. So the assistant director, under the assistant director, there are inpatient services, outpatient services and IV admixture. And also department services, purchase and inventory control, manufacturing and packaging. So each subdivision in the department is assigned different responsibilities. Following are the responsibilities assigned to each division. So we have seen administrative services division. Administrative services division under associate director. So what are the responsibilities of administrative services division? Planning out and organizing the work in department. Developing the policies, the hospital formulary, hospital policies, hospital strategies, everything will be developed by the administrative services division. Making the schedule for personnel and supervising them. Coordinating the administrative requirements of PTC, Pharmacy and Therapeutic Committee. Supervising the departmental office staff. So whether the departmental office staff is working efficiently or no, they will be supervised by the administrative services division. They also make a schedule for the personnel. So from which time to which time the personnel should be working. The schedule is maintained and supervised by the administrative services division. Then assay and quality control division. So they are involved in performing analysis on products manufactured and purchased. So whatever IV admixtures that are being manufactured in the hospital pharmacy and also drugs or surgical equipment that are purchased from the manufacturing unit or distributing unit, testing of those products should be done. So the assay and quality control division will be taking care of the analysis. So developing and revising the assay procedures. So assay procedure will be the procedure for assay to be done on the products will be developed and it will be revised by the assay and quality control division. Then assisting the research division in special formulations. So if the research division is coming up with a new formulations, already existing formulations, from them they are trying to bring a new formulation. So assay and quality control division will be helping the research division in formulating new formulations. Central Supply Services Division, developing and coordinating in distribution of medical supplies and irrigating fluids. As I mentioned, irrigating fluids are used for cleaning of body parts, any kinds of wounds. So Central Sterile Supply Services Division will be supplying the sterile equipment and supplies and drugs. Departmental Services Division, controlling and dispensing of IV fluids. Intravenous fluids are controlled and dispensed by the Departmental Services Division. Controlling and dispensing of controlled substances. As I mentioned, controlled substances are those which are habit forming, narcotics, etc. Coordinating and controlling all drug delivery and distribution systems. Drug Information Services Division. Providing drug information to doctors, medical staff, nurses and nursing students. Maintaining the Drug Information Center. Preparing newsletter of hospital pharmacy. So when any up-to-date information is available in the hospital, or they observe a rare case in the hospital, like example, they observe a rare case of diamond black fan anemia. So the up-to-date information about the disease, the treatment will be mentioned in the newsletter by the hospital pharmacy. So the Drug Information Services Division will take care of preparing the newsletter of the hospital pharmacy. Maintaining the literature files. Like previously done studies, research work will be maintained by the Drug Information Services Division. Education and Training Division. Coordinating programs for undergraduate and graduate pharmacy students. So they will be arranging training and education programs to the undergraduate as well as graduate pharmacy students. Participating in hospital-wide education programs which involves doctors, nurses, etc. So they should also be providing education and training to the doctors, nurses, physiotherapists, etc. Inpatient Services Division. Providing medications for all inpatients of hospitals 24/7. Inspecting and controlling of drugs on all treatment areas. Then cooperating with Medical Drug Research Division. Then Outpatient Services Division. Compounding and dispensing outpatient prescriptions. Inspecting and controlling all clinical and emergency service stations. Maintaining the prescription records. Providing the drug consultation services to staff and medical students. Then Intravenous Admixture Division. Centralizing the preparation of IV solution mixture. Reviewing every IV admixture for physicochemical incompatibilities. If there are incompatibilities in the IV admixture, it will lead to side effects to the patient. So IV admixture division should review the every IV admixture that is prepared. Manufacturing and Packaging Division. Manufacturing various types of commonly used items of hospital. Operating on overall drug packaging and pre-packing program. Undertaking the program in product development. Maintaining a unit dose program. Then Pharmaceutical Research Division. Developing the new formulations of drugs, especially the dosage forms of drugs that are commercially available, and new formulations of research drugs. So Pharmaceutical Research Division will be coming up with new formulations of drugs. Improving formulations of existing products. Cooperating with the medical research staff of project involving drugs. Then Purchasing and Inventory Control Division. Maintaining the drug inventory control. So inventory control is the process of purchasing, storing, distributing of the stock in the hospital pharmacy. So maintaining the drug inventory control is under the control of Purchasing and Inventory Control Division. Purchasing all drugs that are required in the hospital. Receiving, storing and distributing all the drugs. Interviewing the medical service representatives. So before purchase of drugs, the Purchasing and Inventory Control Division will be interviewing the medical service representative of the pharmaceutical company. Then Radiopharmaceutical Services Division, centralizing the procurement, storage and dispensing of radioisotopes which are used in clinical practice. Since radioisotopes require special storage requirements and special dispensing requirements, the Radiopharmaceutical Services Division will be taking care of the procurement, that is collection or purchase, storage and dispensing of the radioisotopes. Sterile Products Division, producing small volume parenterals. So parenterals are IV, IM, IV infusions, IV bolus, IV push, all these are parenterals. So Sterile Products Division will be taking care of producing small volume parenterals, manufacturing sterile ophthalmic irrigating solutions, etc. Then preparing aseptic dilution of lyophilized and other unstable sterile injections for administration. Then coming to the functions and responsibilities of a hospital pharmacist. So pharmacist's role in dispensing or supply of drugs. One of the most important duties provided by the hospital pharmacist is the dispensing of drugs after due verification of the prescription. So if at all there is an error in dispensing of drugs, it can lead to wrong drug dispensing can lead to many side effects to the patient. So one of the most important duties is to verify the prescription before dispensing and check whether proper drug is being dispensed or no. Patient confidentiality shall be maintained at all times. So the patient information should always exist between the doctor, pharmacist and the patient. Any third party or fourth party should not be revealed with the patient information. Appropriate information shall be provided to the patient or the caregiver, and when possible, understanding of this information should be checked. So the patient should be given information about the drug usage, dosage regimen, etc. And the hospital pharmacist should also check whether the information given to the patient is understood by the patient or no. For all prescriptions handled by the pharmacy, patient details shall be checked and confirmed. Proper documentation shall be maintained. So whatever dispensing is happening, there should be proper documentation, the proper record of the medicines that are dispensed should be maintained, so that they can know which kind of medicines are being dispensed more, and the usage of drugs, what kind of drugs are being used more by the patients. This kind of information can be taken from the records. Then assessment of the prescription should include, but not be limited to, assessment of whether the prescription is legally valid. So the hospital pharmacist should check whether the prescription is legally valid. Illegal drugs should not be prescribed in the prescription. The prescription includes an appropriate dosage form and appropriate route of administration. So the hospital pharmacist, before dispensing, he or she should check whether appropriate dosage form is mentioned on the prescription or not. Appropriate route of administration, that is IV, oral, IM, whether the route of administration is mentioned or not, or no. A dosage form like capsule, tablet, syrup, etc. is mentioned or no. Prescription is appropriate to the patient's condition. The hospital pharmacist should also check whether the prescription is appropriate to the patient's condition or no. So some of the prescriptions can have drugs which are not indicated in the patient's condition. So which drugs can be prescribed in patient's condition. Sometimes drugs can be prescribed which are contraindicated in the patient's condition, or the patient's condition may not require those medicines. So those kind of prescriptions should be verified. Duration of treatment is correct or no. So whether the prescription has correct accurate duration of treatment or no. Prescription is compatible with other medications, whether there are any drug-drug interactions in the prescription or no. This should be checked by the hospital pharmacist. Possibility of adverse drug reactions exist. So if at all there is any possibility of adverse drug reactions, the patient should be informed prior about the possible side effects or adverse drug reactions, and they should be informed to consult the doctor if they get any of the mentioned adverse drug reactions. Then contraindicated. As I mentioned, some of the drugs are contraindicated in some of the patient's conditions. So the pharmacist's responsibility is to check whether the patients are given proper drugs or no, whether the drug is contraindicated in the patient condition or no. This should be checked. Potential for misuse and inappropriate use of the medicines in prescription by patient exist. So some of the drugs are habit forming, and there can be misuse of the drugs. Examples like NSAIDs can be misused, or abuse can be done. Painkillers. So the patient will be getting addicted to the drugs and they will start misusing the drugs. So proper number of refills should be mentioned on the prescription, and this should be checked by the hospital pharmacist. Pharmacist's role for promotion of rational drug use. Rational drug use is the use of right drug in the right patient at the right time for a right duration at the right dose. So to promote rational drug use, the pharmacist shall involve himself in activities such as preparation of formularies. What is formulary? Every hospital will have a restricted list of drugs or medicines to which the prescribers need to adhere to while prescribing. So preparation of formularies will be taken care by the hospital pharmacist. Critical assessment of promotional materials prepared by the drug companies. So every drug company will be sending their medical representatives for the promotional purpose, and they will be explaining about the new drugs or existing drugs to the hospital pharmacist. But the hospital pharmacist should not be taken away by the words of the medical representative. He or she should critically assess whether the promotional materials, that is surgical equipment or medical devices or drugs or medicines, whatever they are promoting, whether they are of good quality, whether they are required to the patients. Everything should be assessed by the pharmacist before purchase of drugs from the drug company. Updating the knowledge of drugs through continuing education programs, and also to organize educational programs for health professionals. Then preparation and dissemination of patient information leaflets. Pharmacist's role in patient counseling. Upon receipt of a prescription and following a review of the patient's record, a registered pharmacist shall personally initiate discussion of matters that will enhance or optimize drug therapy with each patient or caregiver of such patient. It should include appropriate elements such as name and description of the drugs. So the pharmacist should open the patient counseling with name and description of the drugs. the dosage form, route of administration and duration of drug therapy. Whether they are prescribed tablet or capsule or syrup or suspension, that should be mentioned. And route of administration, whether they are given oral route or IV or IM, this should be mentioned. And duration of drug therapy, whether they are given the drugs for 5 days or 7 days or 10 days or 1 month, should be mentioned by the pharmacist. Intended use of the drug and expected action. So what is the purpose of the drug? The use of the drug in the patient should be educated to the patient. And expected action, what kind of therapeutic action the drug will be showing on the patient. Special directions and precautions for the drug. So some of the drugs require special directions, like use of inhalers, use of eye drops, ear drops. These should have special directions. So the usage of the drugs should be educated to the patient by the pharmacist. And precautions for the drug, like some of the drugs will be having some of the side effects. So side effects should be clearly mentioned. And precautions should be told, like for example, antitubercular drugs like isoniazid causes reddish discoloration of the urine. So the patient should be mentioned about the discoloration of urine prior, so that he or she will be taking precautions. Then common side effects or interactions and therapeutic contraindications. So if you take this drug, you will be experiencing certain side effects. This should be informed by the pharmacist to the patient. Or drug interactions, drug food interactions should be mentioned by the pharmacist. And therapeutic contraindications, if at all the patient is having contraindication to the drug, the pharmacist should mention it to the patient. Techniques for self-monitoring drug therapy. So the patient should also be educated about self-monitoring drug therapy, where they should be informed about monitoring their medication adherence or compliance. So they can be given advice like keep reminders, keep alarm to take the medicines on right time. Then the patient should also be educated about proper storage of the drugs. Actions should be to be taken in case of missed dose. So sometimes the patient may forget and miss a dose. So what should be done in case of a missed dose? That should also be explained to the patient by the pharmacist. Pharmacists providing patient counseling shall have regard to the following. Only registered pharmacists are involved in counseling. Then patient information leaflets are provided. So every drug comes with the patient information leaflet. So if you open the drug packet, medicine packet, the manufacturer will be providing patient information leaflet. So whether the patient information leaflet is included in the medication or no, this should be monitored by the hospital pharmacist. Proper documentation is made. So every dispensed drug should be documented properly by the hospital pharmacist. Unnecessary counseling should be avoided. Facilities are provided for confidential conversation and patient confidentiality is maintained. So in the patient counseling room, it should be noise proof. Outside voices should not be heard inside. It should not disturb the patient counseling process between the pharmacist and the patient. And also patient confidential information should not be heard outside the patient counseling facility. Then pharmacist role in health promotion. The pharmacist should be involved in health promotion campaigns on health topics. Pharmacists should be involved in particularly drug related topics, alcohol use, tobacco use, poison prevention, etc. So pharmacists should be actively involved in health promotion campaigns so that they can educate the patients. Pharmacist's role in improving medication adherence. What is medication adherence? Whether the drug that is prescribed by the physician is being taken at the correct time, at the correct dose, for the correct duration of time by the patient or no. So pharmacist's role in improving medication adherence. Reviewing how patients are using medications can result in suggestions for changes in medication, dosing or additional therapies that improve patient adherence. Pharmacist's role in providing drug information. To provide for in-service education and training for pharmacists, pharmacy students and other healthcare professionals like medical interns, nursing staff, physiotherapists, etc. Pharmacist's role in managing pharmacy store. Management of the stores, which include purchase of drugs and medicines and other allied stores as per the recommendations of the Pharmacy and Therapeutic Committee. Providing instructions for proper storage of such drugs and medicines. Maintenance of proper records of the drugs purchased and the distribution thereof. Storage and dispensing of narcotic and biological products. Supply and storage of ancillary products and articles required in the hospital. Ancillary products are products which come free for the actual drug product that is being purchased. So some of the pharmaceutical companies, they will be providing free products along with the actual drug products that are being purchased for their promotional purpose. Then next is inpatient or indoor pharmacist responsibilities. In the central dispensing area, to ensure that all drugs are stored correctly, to check the accuracy of the dosages prepared, especially of IV admixtures and unit doses. So single dose prescriptions are available, IV admixtures are available. So pharmacists should be checking the accuracy of the dosage, whether the dosage is correct or no, should be checked by the hospital pharmacist. To keep proper records and preparation of bills, if any. To coordinate the overall pharmaceutical needs of the patient care areas with the central dispensing area. To ensure that the established policies and procedures laid down are followed. So every hospital will be having proper policies and procedures to be followed for the distribution of drugs to the inpatient wards. So pharmacists should be responsible for ensuring whether established policies and procedures laid down are being followed or no. To communicate with all pharmacy staff regarding new developments in the area. So newer updates, new drugs that are released into the market, newer updates, everything should be discussed with the pharmacy staff. To maintain professional competence, keep update with information regarding drugs in current use in the hospital with special reference to their side effects, drug interactions, therapeutic efficacy, etc., as well as their incompatibilities and stability. So the hospital pharmacist should have an up-to-date knowledge about the drugs. Sound knowledge should be there. Patient care areas, wards, operation theatres and other departments of the hospital where drugs of special categories are used. To maintain a liaison with nurses who are involved in the drug administration. reviewing of drug administration in each patient periodically to ensure that all doses are being administered and charted accordingly. So whether the nurses are administering drugs to each patient periodically or no, whether all the doses are being administered or no, whether correct dose is being administered or no, and whether they are maintaining a record of the administered doses. Everything should be checked by the hospital pharmacist. Thank you for listening.